Hello, everyone. It's August the 18th. I apologize for being late. I've been in a meeting with the Secretary of Transportation and Senator Plymel, and we're working on some good stuff, for the possibilities, of how we can do better stuff in Wayne County, and so forgive me for being late. I'm just trying to do what I need to do, but nevertheless. We've got some unreported deaths and unreported illnesses, and active cases that we want to go over today. I have been full disclosure with you all the time. I hate like crazy some of this stuff, just gets into the system on a late basis and everything, and we have to come back and correct and update, but we're going to always report and tell you the good and the bad and everything that goes with it. So as of today, really, we've had 7 deaths since I was with you on Monday, but we have 19 additional, I think, that have now been updated to our system. So I'm going to go through each and every one of those, and I ask for your prayers for these people. We cannot let these people just become a number. The 2,979th death is a 64-year-old male from Mason County. The 2,980th death is a 65-year-old female from Randolph County. The 2,981st death, an 84-year-old female from Kanawha County. The 2,982nd death is a 77-year-old female from Berkeley County. The 2,983rd death, a 44-year-old male from Kanawha County. A 2,984th death, a 79-year-old female from Wayne County. The 2,985th death, a 41-year-old female from Summers County. The 2,986th death, an 80-year-old female from Nicholas County. The 2,987th death, a 79-year-old female from Marshall County. The 2,988th death, a 75-year-old female from Cabell County. The 2,989th death, a 72-year-old female from Logan County. The 2,990th death, a 79-year-old female from Lewis County. And now these 7 folks we've lost since Monday. The 2,991st death, a 69-year-old male from Raleigh County. The 2,992nd death, a 64-year-old male from Putnam County. The 2,993rd death, a 91-year-old male from Jackson County. The 2,994th death, an 85-year-old male from Webster County. The 2,995th death, an 83-year-old female from Mason County. The 2,996th death, a 71-year-old female from Cabell County. The 2,997th death is an 81-year-old female from Marion County. We're 3 people short of 3,000 West Virginians that have died. It's been a long, long, long year and a half now. And all of us want so much for it to be back to normal. But we've got to deal with what we've got. And this is the hand that's been dealt us. Absolutely, we're going to have to deal with this hand, but we don't need to forget all the great people that we've lost. We absolutely don't need to forget all the wisdom that has left us. We'll never forget this time, and I ask for your prayers for just that, for all these great people that we've lost. 820 new cases since our last update. A positivity rate on a daily basis of 7.3%. Our cumulative has now bounced back above 5 again. It's at 5.01. Our active cases, with the numbers that have been, that were not reported, and we moved back into the system of nearly 700 cases. The active cases in the state of West Virginia today are 7,579 people. 165,000 plus have been recovered. 409 people are now hospitalized in West Virginia. 135 are on the ICU units. There's 11 red counties. 11 red counties in the state of West Virginia. That's Barber, Berkeley, Wetzel, Pleasance, Wood, Wayne, Wyoming, Nicholas, Clay, Randolph, and Hardy counties. There's only 3 counties in the state of West Virginia that are green today. There's 458 Delta cases now in West Virginia. I think I said just this. It's too late, West Virginia. It's too late for you to decide, oh, we should have gotten vaccinated. You can't stop this now, what's happened in West Virginia. But you can still save your own life or lives that are around you by getting vaccinated. I don't have any idea how on this planet you could hear these numbers and not run and get vaccinated. You better move, West Virginia, and you better move right this second. This thing is here, and it is absolutely running at a high speed. We know how infectious it is, and we know how deadly it can be. And we know it can affect our kids as well. This absolute variant is just not selecting the old, it's selecting all. Parents, listen to me about getting your kids vaccinated. Please get your kids vaccinated. I absolutely, and surely to God above, I know you don't want me to be here reporting children that we've lost. And you don't want children going throughout their entire life with some level of disability that this has caused. Absolutely, if you are a parent or a grandparent, you need to run to the fire and get vaccinated today. There is nothing as important as this. You have got to listen to the numbers and run to the fire. Again, I remind you, if you're 65 and older and you have any symptoms, get tested. The antibodies will save your life. If you don't believe me, call the governor of Texas right now, who's getting the antibodies right now. From the standpoint of the booster shots, the Biden administration says that they're going to try to begin the process on September the 20th. And we appreciate that they're going to get started on September the 20th. But for God's sakes a living, we absolutely don't need to continue to wait until September the 20th. And we're going to continue to push in every way to be able to get our people that are surely the most exposed, but anybody that is 60 plus, that has been 6 months or greater since they got the vaccine, needs to be getting the booster shot. And so, while I try not to be critical, we're making too many mistakes. We need to move. September the 20th, to me, just isn't going to cut it. And absolutely, on top of all that and everything, you've got all across your TVs and everything, and you see what's going on right now in Afghanistan. And it is just horrible to watch what's happening to our nation and what all the sacrifice that so many gave and everything. We need to move. We need to move. That's just all there is to it. Okay, there's 90.2% of our 65 and olders that have been vaccinated first time, 83.6, and this is a number to celebrate. We now are above 70%. We're above 70%, 70.1% of all eligible, 12 and older, that have been vaccinated. We gave out 2,200 shots since last Monday to people. we thank all those that are involved in the effort and everything, but 2,000 is just not enough. 2,200 people is good, but it's not enough. You better listen to me, West Virginia. I've led you through this as best I possibly can. You trust me. And absolutely, I am telling you with all in me, you got to go get vaccinated. The vaccine eligibility is 12 and above. The CDC just came out with this, and I want you to again listen to me really closely, West Virginia. The natural immunity, CDC is telling us it's not enough. It's not enough to be able to stop this. In a study of hundreds of Kentucky residents who recovered from COVID, the CDC found those who were unvaccinated were almost 2.5 times more likely to be reinfected. So the bottom line is just this. If you've had COVID and you're sitting around thinking, well, I'm protected because my immunities that I have are now, and my antibodies are now going to ward off COVID. I'm protected because I've already had COVID. I can't get it again. You versus somebody that is vaccinated are taking a chance that is 2.5 times greater than the person that was vaccinated. You're going to get this. It's a gamble that I don't see how you take. I just don't see how you take it. Young people, 12 and older, we need our elderly and our parents to step up and say, our kids are going to school. My kid needs to be vaccinated. They all need to be vaccinated, 12 and above. The vaccine info line is all up there. As far as your face coverings, we believe the local control is working, and it is working in a good fashion. I still stand absolutely ready and will move, on a statewide basis as far as face coverings if I deem that that the local folks are not doing a good job and it is not working on the local level. It is something we do not have a playbook for. I am trying to balance and keep us all together. It is very, very, very hard. Without expressing my personal preferences and whatever, I am trying to keep the state all together. And at the same time, balance, the first and foremost requirement is to keep us safe, to keep us as safe as I can possibly keep us. All the testing stuff's up. You can get, the free testing. We thank Fruits. We thank Walgreens. We thank all those for the effort. Take advantage of that. We're down a little bit in our long-term care facilities to 17 and our churches to 8. We have 8 counties on our churches. That's Cabell, Fayette, Kanawha, Mason, Putnam, Raleigh, Taylor, and Wayne counties. We have 45 inmates and 28 staff cases now. I really have encouraged you to give blood. Thank goodness the Biden administration moved. We sent a letter on August the 4th to the president requesting that he reauthorize the funding for the West Virginia National Guard yesterday. He granted our request and everything. We are appreciative of that. One other note that I have here, and there's no question, the funding is critical, from the standpoint of our stated preparedness and everything, with the potential flooding and everything that we're going through right now. Here's some great stuff. Our unemployment numbers in West Virginia have now dropped to 5%. We're at 5% unemployment, and that drop is the lowest seasonally adjusted employment rate for the state of West Virginia since January 2020. So that is the lowest rate that we've had now in 15 months. We saw our employment grow another 1,700 people. The unemployment state residents now have decreased by 2,100 additional folks to a total of 39,900. we dropped 4 points since July, and we're still 4 points below the national average, and all that's good stuff. So just keep doing good stuff, West Virginia. That's great news right there. As far as our state of preparedness, we have that now for all 55 counties with this storm that's moving through here and everything. We're monitoring every single bit of it in every way, and we'll stay right on top of all that. We have a new EEO director, and that just was appointed, and that's Kim Knuckles. And Kim is going to serve as the director of Equal Employment Opportunity at the Equal Employment Opportunity Office. In addition to her new title, Knuckles will retain her role as the State of West Virginia Americans with Disabilities Act Coordinator, bridging the two initiatives and everything. So there's no question that she can juggle two balls at one time. She can walk up the steps and chew bubble gum at one time and everything, and do a lot of stuff that a lot of people say, oh no, you can't do anything but one thing in life, and that's completely silly. So we congratulate her. She's a native of Benwood, West Virginia, a 2001 graduate of West Virginia University College of Law. She is a 1997 graduate of Wheeling Jesuit University. Great stuff, and we congratulate Kim in every way. Here's another thing another incident that I want you to offer up your prayers. But our West Virginia Division of Forestry has dispatched 2 crews to help the folks in Minnesota with these terrible, fires that they have going on there. The 2 crews will with 20 forestry personnel are heading to northern Minnesota and will be expected to be there for 2 weeks to assist with the wildfires. State fire crew members are trained in firefighting and to meet the National Wildlife Coordinating Group standards. Please, again, I offer up my prayers. Kathy offers up hers, that these people have a speedy recovery, and we just know of the great work that they do, and the people up in Minnesota, northern Minnesota, are really suffering right now. So if we can go help, we want to try to go help. That's all I got. Thank y'all.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. I'd like to start my comments today with just a personal comment related to the governor. Working with our pandemic leadership team for now well over 500 days and working very, very closely with the governor, I think it's important for our citizens in our state to recognize what an incredibly difficult balancing act he has, trying to, as he said, keep the state together, pulling the rope in the same direction. And I know that his focus is on the best things for all people in the state. So I just want to personally thank him for his work. I know that's part of the job, but nobody signed up exactly for this job. And I just want to recognize what an amazing job of balancing I believe he's doing. That's my personal commentary. For my comments on COVID-19, the biggest news, as people have heard, is that the federal government plans to offer a 3rd booster dose for people that have been fully vaccinated with either Pfizer or Moderna, and they have focused on 8 months from the last vaccine. And the reason why that's important is what we're starting to see not only around the world, but in West Virginia and in the US as well. And what we're seeing is that still people that are getting the sickest with the Delta variant of COVID-19, which now accounts for basically 100% of the cases in our country and well over 90% of cases in West Virginia, is that people that are unvaccinated are the ones that are having the most severe consequences. But as we are seeing from the country of Israel, that is the most vaccinated large country in the world, and has worked hand in glove with Pfizer to be able to vaccinate their population, they have started to see that because of the incredible infectivity of the Delta variant, combined with some perhaps loss of potency over many months in their most vulnerable people, they're people over 60 years old, that they're seeing that not only are the vaccine breakthroughs leading to symptomatic infection, they have now seen people that are hospitalized who also are completely vaccinated. And they've seen that people that were completely vaccinated and finished in January versus people that were completely vaccinated and finished in April have a substantially more risk of getting ill from vaccine breakthroughs. And what that says is that the vaccines are still working, but in the most vulnerable people that got vaccinated the longest to go, particularly with the infectivity of this Delta variant, that there are people that are starting to break through, which is the reason why I believe that the White House has indicated that we will see booster vaccines for our country September 20th. I also think it's really important to note that in Israelis that were vaccinated in April, they have seen a much, much better continued protection. And in people that got the third vaccine dose, it looks like that they have already also seen already an 86% reduction of severe infections and vaccine breakthroughs. And that really says that, particularly for anybody who hasn't been vaccinated, it is the time right now to be completely vaccinated. Really important with the Delta variant circulating. And although, as the governor said, we can't vaccinate ourselves out of the surge that we are seeing, it is important to note that we may be able to reduce the intensity, the rate of surging, and certainly also we know that we can save lives. Because today, with the deaths the governor reported, we have now lost more people in West Virginia from COVID-19 than we did from the 9/11 incident in the United States. So as we go forward, we are all better together. We need to start to rally around each other to become vaccinated. We will continue with the governor's leadership to push as hard as we can to make sure that we bring all of the most important interventions to the state. The treatment that we have, though, for this pandemic, this virus, are the vaccines. Please use that treatment and be careful. And, as you're in indoor environments and around other people, also consider other mitigation measures. Thank you.
Thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good afternoon. Just like to reinforce a couple of points that the governor and Dr. Marsh just made. We've lost more West Virginians than died at the World Trade Center site in 9/11. I remember meeting with the governor early on in this pandemic, and we were trying to minimize the number of deaths to 60. We are continuing to make significant progress in the 65 and older and the 50 and older population. But we need to do more there because we know, and the governor has pressed us that as soon as booster doses or the third dose can be administered, that we will do that because we know the numbers that Dr. Marsh just pointed out. We did hit a milestone today of, in the 18 to 29 age group, 50% of that group now has a first dose, but that is nowhere near the number that we need to be. And vaccination is, as pointed out by the governor, is only going to help us ride this out and prepare us for the next variant that's going to come. If we look at history, this is going to last for a longer period of time. West Virginia, we need to step up and get vaccinated, not for ourselves, but for the greater good of the state of West Virginia so that we can weather this storm and go on and achieve our full potential. Thank you.
Thank you, sir. Secretary Bill Crouch with the DHHR is also joining us today and is available for questions. Dr. Inamjad had a prior engagement today, and she will rejoin us on Friday. We'll now go to questions from members of the media. The first today from Mark Cram with WDVM.
Well, good morning, Governor. Good morning to all panel members. missed the conference last week. I was enjoying vacation at the beautiful Canaan Valley. So please go see West Virginia. You can social distance and enjoy the outdoors. A few weeks ago, Dr. Marsh talked about gathering data on the level of antibodies in individuals 60 and older. I'm wondering, are West Virginians availing themselves of it? And another question I received is, what is the percentage of individuals with the Delta variant vaccinated versus unvaccinated? Thank you.
Okay, Dr. Marsh, you've got to do the first part, and then maybe, Secretary Crouch or General Hoyer, maybe you could do the second part.
Thank you, Governor, and thank you, Mark, and good to have you back. So as we are initiating our battlefield booster battlefield assessment, we have gained information from some of our most vulnerable in our long-term care facilities. And what we're looking for initially is just to look at whether or not we see an absence of these antibodies that should be directed against the spike protein related to vaccines. And what we've seen in some of our early data that is still being collected is we do see a small percent of people in these facilities that have been fully vaccinated that do not have any measurable anti-spike antibodies in them, which the spike protein antibodies are the ones that come from the vaccine. Anyway, I won't go into details, but we have seen some people that should have these antibodies that don't. And that's a really important observation for us, as we had talked about before, because these people, like the people that are immunocompromised, getting their third dose of vaccine to try to stimulate their immune function, these people fall really into that same category. And as we start to look for vaccine breakthroughs, looking in some of these, nursing home populations, we see more outbreaks in nursing homes today. And we are tracking that we do see some of these people in these outbreaks having vaccine breakthrough cases. So we are underway. We are still gathering lots of information, but we are starting to see some of the information that we sought to see, which is people that got fully vaccinated back in the beginning of the pandemic when we were the first in the country to immunize our nursing home population, that lack any residual immune function that we can measure as far as the antibodies that would be induced by that vaccine. So that tells us that we have a vulnerable part of our population that have been vaccinated that are at risk for certainly reinfections. Thank you.
So you're going to do the second half there? Or was it general?
Yes, Governor, this is Bill. Yes. Let me add one thing to what Clay said. We're looking very hard at our nursing homes again, as we did at the beginning of this pandemic. Approximately 53% of our breakthrough cases now are in nursing homes. So that's very concerning to us. If you look at the dashboard, the number of cases that we have also shows the number of breakthrough cases. We have 3,204 breakthrough cases in West Virginia. That is only 0.36% of the total 895,000 individuals who have been vaccinated. So again, as the governor says, every briefing, every day, please get vaccinated. It is critically important. We have breakthrough cases, but those cases are not as severe. Individuals have a very low risk, less than 1% of dying if they've been vaccinated. So again, it's very important, very critical that you get vaccinated as soon as possible. Thank you.
All right, thank you, Mark. Next to Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking the question. This one is probably for Governor Justice. Governor, I respect that you've maintained that you're trying to keep the decision about mask wearing in West Virginia to the local level, especially where schools are concerned. Although I think it's fair to say, and we all know, that some school boards, as they are comprised, are probably better equipped to make medical decisions than other school boards, just because of varying levels of expertise and experience. So it's not a same across the board for every student in West Virginia. Some school boards probably do a little bit better job, and some school board members are probably not as informed as their statewide colleagues. That being said, if you want to keep it a local decision, what are the chances that you would review it and look to say what's been done in Tennessee, where the governor there said it's going to be as local as possible because regarding masks in schools, he was going to let parents decide. And isn't that ultimately the most local decision that can be made? A parent making a decision about the health of their own child. What do you think about that possibility? Thank you, sir.
Well, Kenny, every parent should and does have that decision-making, capability, and it should lie first and foremost with the parents. Kenny, and this is why you pay me the big bucks, that I don't take any of them. But really and truly, this is tough decisions, really tough. You've got a bunch of our people that won't even get the vaccine. And absolutely a bunch of folks in West Virginia do not believe that they ought to be wearing a mask no matter what. On the other hand, you've got a population of people that truly they feel like in many ways that they're even being slighted by those that are making these decisions, that they don't want to wear a mask, they don't want to get vaccinated, whatever it may be. Tennessee is a ugly baby right now. And we do not want to become Tennessee. We are watching it, Kenny, and I am talking to everybody coming or going. It is a situation where one size doesn't fit all. There are repercussions of wearing the mask and everything from the standpoint that, how they negatively impact and all that may very well be or not. But at the same time, I don't really have a concrete answer other than the fact that we're trying to dance through this as best we possibly can. We're trying to not be invasive. We're trying to give people that are on the ground in their counties, flexibility and control within their counties. We're absolutely giving the parents complete flexibility. And the parents should be the persons that should be the people that are the decision makers. People can go crazy griping about the fact that, you do a mask mandate. Well, we don't want to do that. We don't want to do that in any way, shape, form, or fashion, my say, and everything. But on the other hand, you've got people now that are willing to say, well, if you would just put a mandate on, that's what we would like you to do, because maybe we don't have the expertise or the experience or whatever to be making these decisions. Well, it is a difficult dance. But like I said, I'm not going to shy away from the big decisions and the big problems. I'm going to continue to listen to all the experts that I can possibly listen to, especially the ones that are close to me. And we're going to make the best decisions that we can make from here, but still, those parents have a great deal of flexibility until we make a mandate at the schools or whatever it may be.
All right, thank you, Kenny. Next to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. Hope you're all doing well. We are obviously concerned about the Delta variant and how it may affect kids of school age as they return to classrooms. Could anyone provide information about how many juveniles are among the West Virginians currently hospitalized from COVID-19? And is it possible that that is information that could continue to be provided? And unrelated to that, but a second question, Governor, what's your view on West Virginia welcoming people who are fleeing Afghanistan? Thank you.
Well, I'll I'll kind of just stab at both of them just a second, and then we'll call in the medical team or the medical experts to maybe give you a more concrete answer. But Brad, here's the thing. We probably don't have a whole lot of young people that are hospitalized today. But we do know from all the research that's out there that we know that this Delta variant today can and does affect our youngest people as well. And we know of many, many, many tragic cases. And while we may, if we come out and we say to you, well, we've only got, and I don't know, that's why I'm going to defer. We may only have 3 people that are hospitalized that are, 12 to 15 years old. And then it's going to appear like to our people, well, gosh, we don't need to worry all that much about this. But isn't it our responsibility as adults to protect our children the very best that we possibly can? And if only 3 die or 3 are hospitalized, should we make our people feel like they should just relax and everything, don't worry about it? Because our children are our treasure in every way, and we've got to protect them. We have to protect them. Now, people are going to turn around and say, well, why don't you have people wearing masks? And I absolutely would say this. If you choose as a parent for a child to wear a mask, we absolutely support that 1,000%. If you, in a county where you've got boots on the ground, think that our children should wear masks, then the local people should deem that they know it better than anybody, and we'll do that and support that wholeheartedly. From the standpoint, if it gets worse, that we think on a state level it needs to be mandated, I'll support that wholeheartedly. But absolutely, if the local folks do not think that we need to wear the masks do have some level of negative impact. We got to know that. So all I would say, Brad, to your question is this, and I want all the listeners out there that are watching to know that we surely don't have our hospitals flooded with young people today. But if there are only a few, and it just happens to not be your children, for God's sakes a living, protect our children. And as far as Afghanistan, Brad, I could go on all day long about this. I think it is the god-awfulest disaster that America could put on display that you could ever imagine. And really and truly, as far as taking people in or not taking people in, I would say that decision is a long ways from something that should come to my desk today. I'm worried, and I hate to say this selfishly, I hate like crazy for all the Afghanistan people or Afghanistis that have supported us in every way. But absolutely where my concern is the Americans that are there. And if you think that's selfish, well, you just think it's selfish. That's all there is to it. I want us to get our people home. It's not that I don't care about the others, but I want our people home. And as far as bringing in, others and everything, that's a decision for later. But right now, that's my feelings wholeheartedly. Now, if anybody's got some numbers of hospitalized, people that are young people and everything, whether it be General Hoyer, maybe you could weigh in a little bit on that, but I just don't want to put us to sleep as a people and say, oh, well, I don't have to worry about that, because it is our responsibility in life to look after our kids.
Yes, sir, Governor. Brad, I'll have to get more specific details from our data, but I can tell you that our state epidemiologist yesterday in our update brief told us that 0 to 17 age group has gone up 3% recently in the number of cases, from 13% to over 16%. So we are seeing that occurring, and we are also seeing the average age population of those going into the hospital dropping significantly over the last 60 days. So I can get you more specifics on 12 and under later on and get that provided to you. But clearly the trend is moving towards younger population getting sicker here in West Virginia as across the country.
All right, thank you, Brad. Next to Mark Curtis with Nexstar Media.
Good afternoon, Governor and cabinet members. I want to get some clarity here because the numbers I'm hearing from the White House say the booster shot comes after your second dose after 8 months has passed. However, in these briefings with the state folks, I'm hearing 6 months. And are we in fact going to go ahead and start rolling out the vaccines in West Virginia prior to the federal targeted start date of September 24th?
Mark, let me tell you my feelings. My feelings are this, first of all, I've been told over and over that if you're 6 months out, the odds are your antibodies are going to diminish. I got my antibodies checked right off the get-go when all this came out, when we came out with the idea of the booster battlefield assessment, and my antibodies showed a level of protection, but low. Now, I truly believe without any doubt, period, that if people are 6 months out, they should be vaccinated. For whatever reason may be, whether it be, and again, this may just be selfish on my part, but whether it be we want to do the humanitarian thing and we don't want a run on the store as far as needing the booster shots within America, and we still want to export all kinds of vaccine to other countries, which I think is great. But again, I hate to say it, but I'm going to look after West Virginians and I'm going to look after Americans first. And I believe that we should be looked after first in this because we're the ones with the vaccines. We're the ones that have come up with this. And absolutely, our people are suffering. And if our people are suffering, we need to take care of them. Now, so Mark, the other part of your question is, will we move forward before September 20th? And my feelings are just this. My medical team is going to guide me. If they tell me right now we can move forward this afternoon, we're going to move forward this afternoon because I believe wholeheartedly we should be vaccinating people today.
All right, thank you, Mark. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I had a couple more questions about our booster shots. So I know, at the beginning of the year when people were getting their first shots, we had this sort of tiered system that started with age, and then, certain frontline workers, certain first responders, municipal officials. Are we going to be following a similar pattern as we get to this third shot? And then is the state considering any sort of incentive program for this third shot? Thank you.
General Hoyer, you get ready, but Charles, on Friday, we're going to announce another incentive program designed more at targeting towards our younger people, but on Friday, we're going to come out with another marketing program ourselves. And General, you can take over on the tiering in the first part of the question, please.
Yes, sir, Governor. So, Charles, the reason we did that tiering the last time was because of total availability of doses. So this time, while we will clearly, and we are already working, had multiple meetings with hospitals, with our nursing home and assisted living facility leadership team, we will be pushing out those doses quickly to those particular populations because of the governor's priorities: reduce the number of deaths, maintain integrity of our hospital system, but we will not have to tier like we did last time because doses are plentiful and available and we have access to them. So we can open up to all of our population that need the third dose as soon as possible.
Great. Thank you, Charles. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. Governor, you referenced this a little bit earlier in your comments about the split that's out there among people that believe in masks, that don't believe in masks, that believe in vaccine, that don't believe in vaccine, and the possibility of mandates out there. Do you have a general fear that if you would make a mandate that people wouldn't listen, and if they don't listen, then what do you do?
I don't know, Paul, if it's a fear, because I'm not going to be afraid of anything or anybody. You know, I put my trust in the good Lord, and I'm not going to be afraid, period. From the standpoint of are there people that would just say, no, we're not doing that and everything else, and it caused complications? Sure, that's a concern. And but I want to be, you know, I just don't want to rush and start screaming fire and everything. West Virginia is still doing pretty good, and there's surely areas that would warrant that what we should do is do local control, and that's what we're trying to do. But I'm not going to be fearful, Paul, of what, you know, of a decision, because some people are not going to like it and everything. And right now, as far as a mandate, there's 40 of I think it's, I could be wrong about this, but I think it's 40 states. 40 states do not have a mandate in regard to mask at this point in time. West Virginia, you know, is probably a state that could fragment the easiest over the silliness of just mask. But if 40 states don't have a mandate and West Virginia had a mandate today, yeah, you'd have a problem. You'd have a problem. You'd have to deal with it and everything. But I'm not going to be fearful. I'm not going to be that.
All right. Thank you, Paul. Next to Dave Mistich with West Virginia Public Broadcasting.
Hi, Governor. Hi, panel. My question also is about this booster shot program. Obviously, in the beginning of the pandemic and the role, or well, I should say in the beginning of having vaccines, you know, there was supply was limited. Now we find ourselves in a situation where there's a lot more product out there for people to get shots in arms. My question is how are we going to negotiate the difference between trying to get those that are completely unvaccinated shots versus the people that are already vaccinated a booster shot? And is that going to cause any problems with the amount of stock that we have on hand at all? Thank you.
General, you can answer this. I'm gonna make a little comment on it and everything. I know in my heart that people are, you know, that we have the team and the experts to be able to get shots in arms, and what we've done in the past, I mean, they are so good. They are just plain flat good. And so I don't worry about that at all. From the standpoint of just, well, I'm not going to say more. General, go, please.
Yeah, Dave, and I think what the governor's laying out is the great news with where we're at today, despite the challenges we face, is we're not in a shortage of vaccines. We've got a team of people made up of multi-agency personnel from DHHR to the National Guard to the Hospital Association, the Long-Term Care Association folks, and we federally qualified health clinics. We all work through scenarios led by our operations lead, Joe Peel, and we're prepared to execute doses to more unvaccinated folks because we know we need to do that, and we know we need to get the third dose into our most vulnerable population, and we're prepared to do that.
Come back to me just one second. Dave, what what we're, I hate to say this because this is just point blank how you know that I would say something, but as far as the conflict of people getting booster shots and people that haven't been vaccinated and being able to achieve both that at one time, well, our people will knock that out of the park. But as far as the run on the bank for people to get vaccinated versus people to get booster shots, the one thing that we do not want to happen that scares me to death, and this does scare me, and that is just this and everything. I'm not fearful, but it scares me. And that is just this, is what if we awaken to a situation where there are a bunch of folks dying? We're seeing it right in front of us. We're seeing it unfold right here. Then a lot of the per se hell no's are going to be running to get a vaccine. We don't want that to happen. We don't want to lose a bunch of folks for people to finally decide that they need to go get the vaccine. And that's why we keep pleading with everybody to get it.
All right, thank you, David. Governor, back to you.
Okay, I guess the only thing really that I have to report is you know, again, we've lost 2,997 people. We're 3 people from 3,000 people. It's a crying shame. They need your prayers for all those families and all their loved ones. From the standpoint of our firefighters and our forestry division folks and everything that are going to Minnesota, they surely need your prayers. And today, in reading through this, we lost, I think, a 40-year-old and a 41-year-old and a 44-year-old. So much life in front of them. So much life. And the only other thing I would tell you is, for those of you that love Baby Dog, we're going to have another campaign. It's going to start, you know, and it's going to be centered around a lot about our children and everything. And so we're going to go back out on the road and give a bunch more stuff away and try to incentivize and talk to our kids and everything and try to somehow get more and more across the finish line. But for those of you that don't like Baby Dog, I mean, you must have something really wrong with you in life and everything, and I pity you in every way, but because I've not run into yet a single person that doesn't love Baby Dog. So she'll go with us, and at least a ride to and from will be good. But we'll keep trying to get more and more folks vaccinated, especially our kids right now. So thank you so much.
Hello, I'm Dr. Meera Mehta. I am a pharmacist and infectious diseases clinical specialist in West Virginia. During the pandemic, I've served as an expert on COVID-19 treatment and vaccinations in my state and community. Sometimes patients ask me if there are long-term side effects of COVID-19 vaccination. My answer is there are no known long-term side effects of COVID-19 vaccination. There are some things that we know about COVID-19 vaccines and some things that we're still learning about because it takes time. Here are some things that we do know. The COVID-19 vaccines have been evaluated in tens of thousands of people in clinical trials. Millions of people in the United States and around the world have since been vaccinated. COVID-19 vaccines have continued to demonstrate their safety and are highly effective in preventing severe disease and death. Because clinical trials for COVID-19 vaccines started in early 2020, we're still learning whether we can say with certainty that these vaccines will not have long-term side effects. However, we know that vaccines in general rarely cause long-term side effects. In the rare case when there are delayed side effects, they tend to happen in the first 6 weeks following vaccination. The COVID-19 vaccines have been monitored for much longer than that. There is no medical indication that COVID-19 vaccines would cause future side effects. While there are no known long-term side effects of COVID-19 vaccination, we do know that COVID-19 disease can lead to very severe long-term consequences, even from mild cases. This is why I chose to get the COVID-19 vaccine and why I recommend it to my patients. Thanks for tuning in. I'm Dr. Meera Mehta. For more information about COVID-19 vaccines or to find a location near you, visit vaccinate.wv.gov.